Hello there. My name is Aiden. Today we're going to be doing SDG3, which in essence is good health and well-being. This is the SDG that I chose for the proposed 1 through 5 SDGs we need for global info technologies for this class. Jumping right into it, what is SDG3? SDG3 aims to ensure healthy lives and promotes well-being for people of all ages. Portugal has made significant progress in healthcare, achieving universal coverage and increasing life expectancy. We will look at Portugal's healthcare data and compare it with the US and other areas and propose technology-driven solutions for improvement at the end here. So jumping into the data story of Portugal, Portugal, does have good health and well-being. It's very comparable to the United States and other European countries, in that it's not very far behind as to some third world countries are. And we're going to take a look at just some of the statistics and comparing them back to the United States. For example, life expectancy, which this one kind of threw me a little bit. The life expectancy in Portugal is 81 years, which is slightly higher than the global average. And in the United States, it's actually only around 77 years. This is very interesting, I think, because when we look at the healthcare spending, you see that the United States spends a lot more money on healthcare. So I find it very interesting that the United States has a lower life expectancy than Portugal. Looking at healthcare spending, as mentioned, Portugal spends about 9.1% of its total GDP on healthcare. And the US, comparatively, spends approximately 17.7% of its GDP on healthcare, meaning that the US almost spends about double the amount of its GDP on healthcare. And it's weird to see that discrepancy with life expectancy. Mental health statistics, mental health, common occurrences you see in Portugal, much like other westernized European unions, is depression and anxiety are very prevalent in Portugal. However, comparatively, the country also has limited mental health resources per capita. Healthcare accessibility, urban areas are very well served, but rural populations face limited access to specialized healthcare services. Healthcare is centralized, and that's different from the way that the U.S. does things, as healthcare in the U.S. is highly variable. It's not the same for everybody, and you really have to look into that. And that's some of the things that you don't see in places like Portugal and Canada. Chronic diseases, common issues include cardiovascular diseases and diabetes. Portugal has lower obesity rates than some countries. Noteworthily, the U.S. has one of the highest obesity rates in the world, which in turn contributes to a lot of these chronic diseases being more prevalent. Here's the X-Mind map that I created for this SDG3 in Portugal. I saw some of the challenges is healthcare accessibility in Portugal, especially in those rural areas. Mental health resources are lacking, and preventive healthcare is also not as used as in some other countries. Some of the goals is to increase this mental health resources and accessibility, really reduce some of these preventable diseases. And then as we look at a comparative analysis comparing kind of across the line to the United States and other places, you see that it's only 9.1% of GDP in healthcare, as it's not very high comparatively. It also has centralized healthcare, which makes it a lot easier for typical citizens to get healthcare. And also that limited capacity in specialized services. As compared to the United States, we have medicine and cancer and other various areas that are very specialized. You don't see this as much in Portugal. You also see a lot of these emerging technologies here, like telemedicine expansion, mental health platforms that have been created, and as blockchain develops, you see this blockchain for data security as well. So that's going to include the X-Mind map here. Some of the solutions for this SDG3 in Portugal is I propose that job creation initiatives focus on creating job opportunities. Good health and well-being is not just about your health, your physical health. It's also about performing in society, and I think getting a job is one of those things. Access to education and training, obviously. Social safety nets, introducing the idea of social safety nets, like things like financial assistance, healthcare, and housing support, and also that technology integration can help with efficiency and other things by providing resources and really connecting people to opportunities that they need. Thank you so much for listening to this presentation on SDG3. It's going to be good health and well-being. We're going to get into some more SDGs later on in the course. However, that's going to conclude for today's session. I appreciate it. Thanks so much.